Okay, so I am going to record the presentation so it's available for those that were not able to join today and for future needs as well. So with that said, we're going to go ahead and get started with the benefits. So the agenda is to go over the medical benefits, the new plans, obviously, the Delta dental plans, the vision, the Unum life insurance, and then Aflac. So open enrollment started yesterday, so the opportunity to come on to the Aetna plans, enroll yourself and all of your dependents. The elections that you make are going to be effective July 1st and run until December 31st, 2020. Some eligibility here in qualified events. So eligibility, all employees working 30 plus hours are eligible for the benefits, and additionally, legal spouse, domestic partner, and children up to the age of 26. As stated earlier, these benefits are going to be effective July 1st and run until the end of the year. During that time, you cannot make any changes to those benefits, medical, dental, vision, unless you have a qualified event. So some examples are marriage, divorce, loss of coverage, things of that nature. You would want to notify your CBR HR team immediately upon that qualified event so you can make changes or review your options. If you exceed the 31-day window, you do have to wait until the next open enrollment period to make any changes. So very important there to keep in mind if you have a qualified event. We're going to jump right into the medical plans. You do have 3 medical plans to choose from, 2 different networks. So the first plan here is called a JV Banner 6500. So JV Banner is going to be the network. That includes all the Banner hospitals, urgent cares, facilities, doctors, additionally Honor Health, Scottsdale Shea, and University Medical Center here locally in Phoenix and in Tucson. All those hospitals are in the network. It's called a narrow network, but it actually in the state of Arizona, it's a pretty big network, and it continues to grow as Banner continues to build facilities, actual brick and mortar facilities, and then partnerships with other hospitals and urgent care centers. So this plan is a $6,500 deductible for an individual and a $13,000 deductible for the family. So your deductible is going to come into play with major medical. So if you need to get an MRI, a CAT scan, surgery, a baby, that's when you're going to have to worry about your deductible. If you're just going for your preventative care, maybe a sick visit or a telemedicine visit and fill prescriptions, you really don't need to worry about that deductible. If you, under the Cigna plan, have met any part of your deductible, I would recommend that you go onto the Cigna website and print your last explanation of benefit, or EOB, print it out and get it over to your CBR team so we can send it to Aetna. Aetna will give you deductible credit. So if anybody's met any part of their deductible, please have them send us that information so we can offset that deductible. Now, in this plan, if you happen to meet that deductible, either individual or family, you will be into 100% coverage. So if you've met a portion of your Cigna deductible and now you're having procedures done later part of this year and you meet that $6,500 deductible as an individual, there will be no more out-of-pocket costs for services in that calendar year as long as you stay in the network. So if you would need to have another surgery or therapies, MRIs, CAT scans, even doctor visits, specialist visits, or pharmacy, you will be covered at 100% at that point. Preventative care on all 3 plans of preventative care is going to be covered at 100% with no out-of-pocket expense. What that means is you can go in for your testing depending on age and gender. For the children, the ladies and the men, at 40, the ladies get a mammogram at no cost. At 50, we all get a free colonoscopy. Happy birthday. So under healthcare reform, there are 63 exams, preventative exams we're entitled to dependent on the age and gender. So I highly recommend that you set up those preventative exams with your providers. If you happen to go in and get that exam done and this last part of the year and you receive a bill, please send it to us because sometimes there's coding issues the way it's submitted to Aetna. So please get us involved so we can assist with that. Your regular office visit, whether it be your doctor, your primary care physician, a walk-in clinic, the little clinic at Fry's, or any of those standalone type clinics, it's going to be a $30 copay. Your telemedicine is also going to be a $30 copay. However, at this time, until July 31st, all telemedicine visits are going to be at no cost to you. So if you have to use your teledoc through Aetna, there should be no copays involved there. Specialist visits are going to be $65, and you can self-refer to specialists. You do not need your primary care physician to write a referral. Very important there. Your urgent care and your emergency room are going to be subject to that deductible. So you still want to show your Aetna ID card so you get the contracted negotiated discount rate. Urgent care is going to run you about $90 out of pocket. Emergency room depends on what you go in for. If it's anything related to the current situation with COVID-19, you should not experience any out-of-pocket costs there. You also have prescriptions available at copay. So it's $3 or $10 for your generic medication. Your preferred brand name is $35. Your non-preferred brand name is 50% of retail, and specialty drugs, specialty medications are going to be 30% up to $300. Now, if you're on maintenance medication and your doctor can write you a 90-day script, you can use the Aetna mail order, and you save one copay to get a 90-day prescription. You can also get the 90-day prescriptions at the retail stores at the pharmacy, but you save no money there. You have to pay basically 3 copays. Any questions on this first plan? Okay. We're going to move ahead to the second plan. So this is the Open Access Managed Choice. This is a different network. This is a large national network. This network, it includes the Phoenix Children's Hospital on the network and the Mayo Clinics here in Arizona and throughout the United States. So if you have kids away at college, maybe outside of Arizona, this is probably a good option. And this is a high deductible health plan. So what that means is that you pay first dollar for all of your services. The beauty of the high deductible health plan is you can pair it with your health savings account or HSA. And we partner with UMB so we can, help facilitate the transfer from your paycheck into the UMB account. So it's a seamless process. So this particular plan is a $5,000 individual deductible and a $10,000 family deductible. Again, I'm just going to stress, if you've met any part of your Cigna deductible, get that information over to us so we can offset the deductible with Aetna. On this plan, if you happen to meet the deductible, at that point, Aetna will start to pay 80% of costs and you're responsible for 20 until you meet that out-of-pocket. So that maximum out-of-pocket is worst case scenario in a calendar year, in this case from July to the end of the year. $6,350 for an individual, $12,700 for the family. That's your maximum exposure. That's how much you would have to expect if you use all of the benefits throughout the year. Preventative, again, 100% covered, so please schedule those visits. Because it is a high deductible health plan, your regular doctor visits, your specialist, your urgent care, your emergency room, and some medications are going to be subject to that deductible first. Again, you want to make sure that you show your Aetna ID card so you pay the contracted negotiated rate. There are medications that are available before the deductible, and they're preventative drugs and FDA-approved contraceptives. Those are free at no cost. If you have a question, if your medication falls in that list or category, please email me and I can definitely take a look, or I can send out the formulary. Any questions on the high deductible health plan? Okay, we're going to move to the last plan. Again, this is the national network, the Open Access Managed Choice Network. So this is a larger network with the Mayo and the Phoenix Children's in the network and a lot of the specialists here in the Valley. This one is a $6,350 deductible for an individual, $12,700 for the family. And same as the first plan, if you met that, you've met your out-of-pocket for the entire year. So you would be into 100% coverage on this plan. Your preventative care, once again, covered at 100%, so schedule those visits. Your office visits, walk-in clinics, telemedicine visits are a $25 copay. Your specialist, your urgent care, and your emergency room are going to be subject to your deductible. Again, remember to show your Aetna ID card so you pay the contracted negotiated rate, and then you have copays available for your pharmacy as well, and you can also take advantage of that 90-day mail order and save one copay there. Any questions on this Open Access Managed Choice? On our call from yesterday, the question came up, does this qualify for a high deductible health plan? And the answer is no, because there are co-pays before deductible. So that discounts it or removes it from being as a qualified high deductible health plan and HSA compatible. It is FSA or flexible spending account compatible, as is Plan 1. So Plan 1 and Plan 2 are flexible spending account compatible. Plan 2 is your health savings account compatible plan, or HSA. Okay, next we're going to speak a little bit of your HSA account or health savings account with UMB Bank. Again, you have to enroll in that Aetna $5,000 high deductible health plan in order to be eligible to open your health savings account with UMB Bank. We provide all the instructions on your benefit guide on how to do so. And then also my understanding is our team sends out an email to those employees that select the high deductible health plan and deductions coming out of their paycheck. They get an email with instructions on how to open that account. It is very important that that account be open, even if there's no money in there before the first claim hits. Once a claim hits, you can use those pre-tax dollars to pay for those services. If the account is not open and you have a claim, you cannot use the money that goes in there to pay for that past claim. So it's very important to notate that. We want to make sure that everybody takes advantage of the pre-tax savings. And speaking of the pre-tax savings, the HSA or health savings account is a triple tax savings account. So the money that you elect to go into your HSA account is pre-tax dollars, lowering your taxable income. The money goes into an account, and once you reach a balance of about $1,000, you can start to invest those dollars. Any interest earned is going to be tax-free. As we start to age, we can use those dollars to pay for Medicare premiums, start to withdraw for our personal health needs with no tax penalty. So it's a triple tax savings. The HSA account or health savings account is your account. You own it. Goes with you, stays with you. You can use it to pay for medical, dental, vision for yourself and dependents. There's a whole list of qualified items that you can use. There's the Amazon now, conveniently partners with HSA and FSA, so you can go in there and purchase all of your HSA and FSA qualified items. There's a whole list of things that you can purchase with those dollars. A couple of rules on the HSA, though. In order to qualify for the health savings account, you cannot be covered under another plan that's not a high deductible health plan. For example, if you're on a spouse's plan and it's a co-pay type plan, that excludes you from being able to open an HSA. You cannot be enrolled in any part of Medicare, and you cannot be somebody else's dependent on their tax returns. So those are things that you need to keep in mind when enrolling in a high deductible health plan and open an HSA. Also, the IRS sets limits to the amount of pre-tax dollars you can put into that account. As an individual, it's $3,550, and as a family, it's $7,100. And under IRS rules, a family is going to be considered one plus, so one plus a child or a spouse or an entire family. If both husband and wife are on a high deductible health plan combined, they cannot exceed the $7,100. However, if you're 55 plus, you can add an additional $1,000, making it $4,550 and $8,100. And they allow that. They call it the catch-up provision. Allows you to add more money, because once you join Medicare, that stops your eligibility from putting money in your HSA, but then you can use those HSA dollars to pay for Medicare premiums. Any questions on the health savings account? Okay. We're going to move next to the flexible spending account. The HSA is compatible with Plan 2. Your flexible spending account is going to be compatible with Plan 1 and 3. Your flexible spending account, similar to an HSA, pre-tax dollars going into that account. On this type of account, it's front-loaded. So if you say you want to put $1,000 in there, you'll have it day one. Keep in mind it will be deducted from your paycheck from July 1 till the end of the year. So if you want to put the full amount, which is $2,500, just know that it's going to be coming out of your check. Also, for the flexible spending account, there's a $500 maximum carryover provision. So into the 2021 plan year, you may carry over up to $500. If you have $1,000 in there on December 31st, unfortunately, you would forfeit $500. So I would recommend doing some quick math, co-pays, pharmacy, doctor visits left, things of that nature. Or if you're paying for orthodontia for children or you're going to get glasses, I would add those dollars up. And then max put that amount of money on your FSA card. You want to make sure that you're going to be able to have those deductions throughout the rest of the year and that you don't lose any money at the end of the year. We also have the dependent care flexible spending account, again, pre-tax dollars that go into a holding account. You may use those dollars to pay a qualified daycare or elderly care. The money is not front loaded, it's put in that account as it comes out of your paycheck, so it works a little bit different there. Any questions on the flexible savings account? I have some Aetna resources here. So as an Aetna member, once you get your ID card, I highly recommend you go onto the Aetna website, register so you have access to all the things that are available under Aetna. The nurse on call is one. You should have a phone number in the back of your ID card. If not, you can go on to your Aetna.com website. Nurse on call is 24/7, 365, and they'll have all of your information at their disposal so they can speak to you in regards to side effects to new medication, drug interactions, and guide you with care. If they recommend you go to urgent care, wait for your doctor, etc. We also have a wellness program through Aetna. It is called Attain. It is iPhone compatible, so you download the app to your phone, and you may also order an Apple Watch through that same app. So the way that works is as long as you meet your wellness goals month over month, you never have to pay for that watch. I've been on it now for almost a year, and I haven't had to pay anything, and I've accumulated points that I will be able to cash in for gift cards at the end of the year. So a little bit of a Christmas shopping there. So I recommend that you go in once you register with Aetna, download the app to your iPhone and log in, order your iPhone if you would like to do so. Again, if you don't meet your wellness goals month over month, you do have to pay $8 a month for the watch. Aetna also has their mobile app, so helps with finding a provider, pharmacy, the closest urgent care, things of that nature. And then you can also see your ID card on your phone. And then the next side of the slide is your telemedicine through Teladoc. Very important. I highly recommend, again, going in and registering with Teladoc, downloading the app to your phone so when you need those services, you have access to them. So these are board certified physicians available 24/7, 365 wherever you are in the United States. If you're on vacation, if you're traveling for work and you're not feeling well, you can call the provider. They can write a prescription and send it to the pharmacy that's closest to you. All of the general visits right now are free until the end of July, and they may be extended beyond that at this point. We don't know, but if that happens, we will make sure to communicate to everybody if those general medical visits co-pays have been waived, and that is for everybody on Plan 1, Plan 2, or Plan 3. So those visits are going to be free. I've been utilizing them in the last couple months, not going into doctor's office, and they worked out really well for myself and my family. So I highly recommend the Teladoc services. Any questions? Okay. Some information here in regards to Aetna Banner. I sent over a flyer yesterday that hopefully will be distributed, talking about the Aetna Banner, what they can treat, the doctors and the hospitals in the network. Pretty big network here in Arizona. If you would like to check if your doctor is in the network, you can send an email or give us a call. We'll be happy to check for you. Again, here's just a list of more providers. Under the Banner network, the Phoenix Children's Hospital is not in the network, but Cardin's Children's Medical Center is in the network. They're still pretty good facility, and they're throughout the valley as well. Next, we're going to go over your 2 dental plans that are available. Both of the plans are with Delta Dental of Arizona. So the first plan is the PPO plan. That is your traditional dental plan where you have an allotment of money to use towards your dental services. So if you have a dental plan right now, you've already maxed out the amount that you can use, it starts all over for you July 1. So you have another $1,500 to use towards your dental services. So preventative care under Delta Dental includes your cleanings twice a year. Starting July 1, and you can space out those cleanings whenever you want. If you want to get one in July and one in June, they don't ask that you wait 6 months. You can schedule them at any time during the year. Additionally, if you have certain medical conditions such as coronary heart disease, hypertension, or are pregnant or have diabetes, you get an extra cleaning at no cost. So that's 3 cleanings in the year. Basic services such as emergency services, non-surgical extractions, and cavities, it's an 80% cost share. So Delta will pick up 80, you pick up 20%. And at that time, if you use those basic services or major services, you will have a one-time deductible of $50 for an individual or $150 as a family. Okay, major services, which are going to be your dentures, your implants, your root canals, your endodontics, periodontics, that's a 50-50 cost share between you and Delta Dental. Again, your annual maximum per member enrolled in the plan. So if it's you, a spouse, and children, each of you have $1,500 to use towards your dental services from July 1st to December 31st, and then it resets again January 1. And then you have an additional $1,000 to use towards child orthodontia, and that is a lifetime benefit. And as you notice on the screen, the in and out of network benefits are exactly the same for Delta Dental. You may go to an out of network provider and Delta will still pay them. However, that out of network provider may balance bill you, which means they will ask you to pay the difference from what Delta paid them to what they charge, because they don't have a contract with Delta, so they can charge whatever they want. The next plan I'm going to go over is called the DHMO plan. It is still with Delta Dental. So similar to a medical HMO, you do have to pick a primary dentist. So each member in the family may have their own primary dentist, and then you can change anytime throughout the year. If you don't elect a primary dentist, Delta will appoint one based on your home zip code. But again, you may change it at any time. This plan does not have an annual deductible, and it does not have an annual max, which means you can utilize a plan throughout the year and as much as you would like. You still have your preventative services, which are your cleanings twice a year, and everything else after that is going to be at a fee schedule. So I'll show you an example of fee schedule here on the next screen. So it's basically a list of dental codes and the cost for each of those dental codes. There's a lot of services under this plan. So your cleanings, your teeth bleaching, child orthodontia, adult orthodontia, implants, dentures, pretty much everything under the sun is going to be covered, but there is going to be a price associated, and usually it's at a much deeper discount than a regular dental plan or dental office. So, but you'll know exactly how much you're going to be charged for those procedures. That the reason that you have to pick the dentist is because Delta pays each of those dentists a fee or for having all the members go there, and because their prices are deep discounted. So a root canal is $246. So very good discounts there. I invite you to take a look at that summary. And if you have any questions, please let me know. If you enroll in the DHMO, you'll get a letter with your ID cards, and it'll tell you who your primary dentist is, and also give you instructions on how to change dentists if you need to do so. Any questions on the dental plans? Okay. So just like everybody else, Delta has the phone app, and I recommend again going to the website or downloading the app so you know how much of the benefit you use to find dentists in the network, take a quick oral health risk assessment, and then some guides to your care. Next, we're going to go over the vision plan. Now, the vision plan is through Delta Dental, but it is with iMed, and it's using the Insight network. So iMed itself has a couple of networks throughout the United States, Insight being one of their largest and the ones that provides the deepest discounts. On this plan, your eye exam is available every 12 months, and it's a $10 copay. So if you've already had your exam and got your glasses, maybe this time you get your contact lenses. So your frames, if you choose to go with glasses, you have a $120 allowance to use towards those frames, and then you get 20% discount anything over $120. And that, again, is available every 12 months. Your lenses, as long as those are plastic lenses, single vision, bifocal, and trifocal are going to be a $10 copay. And you can have the polycarbonate, the tinting, those are all going to be at a copay as well. Contact lenses, you have an $80 allowance, and those available every 12 months as well in lieu of the lenses for your glasses. So you can get either one each year, or you can get both and just get a discount on, it's a 40% discount on materials over what the benefit pays. So for example, if this year I went in, had my exam, got my glasses, my lenses, and then I wanted contact lenses, I can still purchase the contact lenses at a 40% discount. Or on the reverse side, I can get my frames, my contact lenses, and get the full $80 allowance and then pay a 40% discount on the lenses for my frame. So I can still get both in the year. You can only get the full discount for one of the lenses. That's just the way that, most insurance companies work. So if you have medically prescribed contact lenses, those are always going to be covered at 100%. Any questions? Okay. Now we're going to move to the exciting stuff, life insurance. So life insurance, the company is going to continue to pay for $10,000 of life and AD&D for all employees. So we do have the beneficiary form that we would like everybody to complete, and I'll go over that here shortly. Additionally, from the life insurance that the company is paying for, you have the ability to purchase up to 5 times your annual earnings, up to $5,000, and $200,000 of that being guarantee issue. So guarantee issue means you will not undergo any medical underwriting. You will not be denied if you had been previously denied due to medical conditions. And you can do that no questions asked. Even if you purchase the minimum of $10,000 as the employee on the voluntary basis, you can continue to increase that life insurance year over year with no questions asked, as long as you do not exceed that 5 times annual earnings up to $200,000. You may purchase more than that, but anything above $200,000 will require medical underwriting and what they call evidence of insurability. So that's for the employee. For the spouse, you can purchase up to $25,000 at a guarantee issue. Again, no questions asked. And for a dependent, it's $10,000. It's a great opportunity, and it's really economical. We went over the pricing. It's 88 cents for somebody 24 years old for $10,000 of life insurance and AD&D. So doubling that amount to $20,000 for 88 cents should they pass away in an accident. The same is true for your company-sponsored life insurance. If you pass away in an accident, your beneficiary gets $20,000 versus $10,000. So really good benefits. I invite you to take a look at these and take advantage of them this year. Next, we're going to go over the voluntary short-term disability. So this is paycheck protection in the event that you can't work due to a non-work-related accident. So this is off the job. So this short-term disability, again, is voluntary, 100% voluntary. AFLAC also offers short-term disability. So if you're interested in the short-term disability, I invite you to compare the two and see where you're going to get more coverage for less money. So this plan covers 60% of your pre-disability earnings up to $1,000 a week. The benefit starts to pay on the 14th day of sickness or accident, and the benefit duration is 11 weeks. There, right now, because you're coming new on to CVR, there is no evidence of insurability that needs to be completed, but there still is a pre-existing limitation, which is a 312. So that means if you were diagnosed, took medication, or were diagnosed with a condition 3 months prior to the effective date, that particular condition would be excluded or non-compensable for 12 months. But anything else unrelated to that, you would be paid out for. So here are some other benefits available to all of the employees. The Employee Assistance Program through Health Advocate. So 24/7, 365 counselors available to speak to, and it's 3 visits, either face-to-face or telephonic or Skype per incident. There's no reporting sent back to the employer, no reporting in regards to what you're calling about, who you're calling about. It is 100% confidential. So the service is there at no cost. You also have a travel assist program by Assist America, and this is all courtesy of your employer paid life insurance. So the travel assist covers you should you travel 100 miles outside of your home zip code. Should you run out of, lose your money, lose your wallet, your visa, you're traveling outside the United States and you need to get medical assistance, you need to be brought back into the United States, this is something you need to have handy. I'm going to request that we get some ID cards, wallet cards, so everybody has that handy should they, travel 100 miles outside of their home zip code. They have this free assistance. And next, we're going to turn it over to Jose to talk about Aflac.
Well, good morning. Good morning. Thank you, Leticia. So, guys, the Aflac voluntary product is technically designed to supplement and help you enhance your current medical plan. So, once you go through your medical choices, this is additional coverage for you and your family that you can pick on a voluntary basis. So, I'm going to go over some of the plans. Some of you have seen the quacking duck running around the commercials. We are the leader in the supplemental piece. So, some of the products that most people know us for is the accident plan. That's when people get injured on and off the job. They get, they're working out, they're training. Maybe a kid gets injured outside, after school program. So there's an initial benefit for seeking medical attention. So I'm going to go over how the plans really work. And all the benefits are designed to pay you directly, not to pay the doctors or the hospitals. So if you have a copay, some sort of co-insurance, some sort of out-of-pocket expense, you can use the Aflac benefits to offset those costs. But most people, get to use the money however they want to. So if there is an injury, like I said, it's designed for the whole family. It's not a shared benefit, and there is no limit on those. So you have a very active family, whether it's a small injury, some serious injury, it's the same coverage. There is an emergency room, urgent care benefit, x-rays, major diagnostics, any kind of exams. If it's more serious, you need physical therapy, you need hospitalization, maybe surgical benefits. All of these benefits are going to be added, and you receive the payment usually within about 4 to 10 days once we receive the claim form. And we can assist you with all of that. We have a very popular coverage for sickness-related events such as cancer. The cancer plan that most people think about is in addition to your major medical. So if you get a second opinion, you want to go to the Mayo Clinic, we don't have a network for any of our coverages. So you can pick and choose whoever you want to go to. We don't coordinate benefits with your major medical, regardless of which plan you select. So there's no coordination. So you will always receive the benefits that are designed to for this plan. So you have different levels. You have a lower level and a higher level. The initial benefit is $2,000 or $4,000, depending on what you select. Children are automatically covered at no additional cost on this one. And mom and dad have an additional annual wellness. So you can go get a physical exam, a MAM, a PAP, PSA test, and then this will be covered by AFLAC just to make sure you're in good health. If there is any event of initial, diagnosis, there's going to be ongoing treatments between $300 to $600 on a weekly treatment, and that's the one that most people know the specific illness. There's a second plan. There's a lump sum critical illness, and a plus rider. Those are more like heart attack or stroke or major organ transplant or kidney failure, coma, paralysis. Those are the ones that are going to physically pull you out of the workforce. And when you need that initial, influx of cash, Aflac pays at 10,000 on one and 5,000 on the other, and it's really designed to give you that extra layer of protection if you had to take out, to pay for some of that initial bills. So that's the first more of a sickness related event. And then we have one, it's called the hospital choice option, and I saved that one for last is because this one, most people think of the gap insurance in the past. You can pretty much customize this to you or your family, whether you want to protect $1,000 or $2,000 for the first night in the hospital. And that's, again, not a shared plan benefit. It's, individually for each member of the family. So if mom or dad or dependent children up to the age of 26 gets hospitalized, they'll have the first night in the hospital, whether it's sickness or injury, they'll receive this benefit up front. So there's other additional benefits on that one, but they're really designed to offset the emergency room, any hospital stay, gives you the initial and daily cash benefit while confined to the hospital for a sickness or injury or childbirth. And, you can scale it up or down. So these are very customizable plans. We do have a short-term disability plan, like Leticia mentioned. Ours is a little different. It's, again, it's fully portable. All these plans go with you, and you get to customize based on your annual gross income. And it's a 0-14 elimination. So we'll start paying from the first day of an injury and after the 14th day of a sickness. and we can help you customize those, design those more based on your personal income. And that's only just for you, the employee. That's limited to just employees only. So um, I'm going to pass it back to Leticia, but if anyone has any questions about the Aflac coverage, how we work, what we do, maybe you had it in the past and you want to check it out, my contact information is here. Leticia is going to send out the packet. Please shoot me an email, and let's schedule a time, whether me or Jason, one of our agents, is going to help you go over the details. But um, any questions about the Aflac coverages, guys?
Jose, I just have a quick comment. Yesterday during the call, a couple of people were asking about a gap plan because I believe they currently have one.
Okay.
And what we explained is that that they should really set up an appointment with you so that you can go over all the different products so that they can substitute that gap plan that they currently have with, you know, maybe a hospital plan or some of the other plans that actually pay them cash directly, because if I'm understanding correctly, the gap plan pays the providers or pays, you know, a little bit different than your policies.
That's right. So a little bit of a contrast there. So that's a limited benefit as far as the cap, and there's other kinds of options. But for ours, you can pick and choose whichever plan you see here. It's cafeteria style. So say you want the accident plan, and that one has an initial hospital benefit of $1,000, and then you also get the hospitalization plan that also can be 1,000 or 2,000. So you can customize those. But there's two things that come with it. All the benefits come back to you on behalf of the treatment of your family members or yourself. And then the employee is going to receive, if it's surgical benefits, if it's ongoing treatments, physical therapy, there's additional benefits that are built into each plan. So it's a lot richer. And like I said, these are pretty much cafeteria style a la carte. So the gap plan is a little bit more, lump sum, and it pays to the provider. We do not pay the provider.
And then
Got it.
just to add a little bit more to the gap plan, so they max out during the year. The Aflacs don't max out. So if you have multiple accidents throughout the year or hospitals multiple times throughout the year for different things, they, excuse, they will continue to pay. Is that correct, Jose?
Yes, it will continue to pay. So, like, say you have a very active family or a very clumsy family. You guys are go hiking every weekend, or, kids are playing sports. Urgent care visits are, most of the time that we use that accident. But something more severe, we're still going to pay for those as an individual claim every time it occurs. If it's an initial event and then there's follow up, somebody had a bad surgery, a bad injury, and then they have multiple surgeries. It's all based on that one. And then there's no limit on that. The hospitalization, it will be if it's for a same event, annual base, the 1,000 or 2,000. But again, it's not a share benefit, so it's 1,000 for you, 1,000 for the dependent. So say you're planning a young family, you're planning a family, this will be a good plan to have in case you're going to spend the out of pocket for the deductible. So 6,500 could be 5,000. So we'll be glad to review those medical plans with you to make sure that we help you match the correct plan coverage for your family.
Thank you, Jose. And I do have the interest form that was sent out. I'll go over it just in the next few slides as well. And some other offerings that we have, a Legal Shield and ID Shield. Legal Shield is just that, so you have access to attorneys to go over contracts, legal disputes, things of that nature. You can call them 24/7. They have attorneys ready to help. ID Shield protects you against identity theft or helps restore you if you've been a victim of identity theft. So it protects you and your family. There's a couple of different options there. And then pet care, so covering our pets, not limited to cats and dogs. There's a whole list of pets that are covered. And there are a lot of providers here in the Valley that are part of the United Pet Care family. So if you have a provider already and you want to know if that provider is within the family, you can send me the information and I can reach out to United Pet Care. Just a few reminders here that everybody please needs to return their enrollment form by the 23rd, the 22nd, Noemi would prefer by the 22nd, just so we get everything into the providers and everybody has is enrolled at least by 7/1. And then, of course, the employer paid life insurance. We have those beneficiary forms that everybody needs to complete. If you are married here in the state of Arizona, we are a community property state, so your legal spouse is automatically your beneficiary. We do have waivers if he or she would like to sign those. Flexible spending account, we have the forms that need to be completed. And if you're enrolling in that high deductible health plan, aside from the outreach our team does after we review your enrollment form, I recommend you go into the benefit guide and take a look at the instructions on how to open that account. Does anybody have questions before I move on to the forms? Okay, I'm going to move on to the enrollment forms. So this is the enrollment form that we'd ask everybody to return, either an enrollment form or a waiver. We have to collect one from everybody. So at the very top it says must be returned to CVR. We ask that you complete it to the fullest. If you have dependents, we will need social security numbers. So we have to have those. Section C is where you're going to elect the medical plan, either plan 1, 2, or 3. Remember, plan 1 is going to be that banner plan. Plan 2 is that high deductible health plan. And if you're going to have any of those pre-tax dollars going into your HSA account, this is the section where you want to put that dollar amount in. Section D is going to be your dental and vision. If you're going to enroll in the DHMO, there is instructions here on how to find a DHMO provider. And then we just ask that you fill in that facility code. If you do not do that, or again, Delta Dental is going to assign you a provider based on your home zip code. Just know that. And then a quick note, all of these benefits are separate from each other. So if you just want to enroll the family in dental, you may do so. If you just want to pick medical, you may do so. So all the benefits are going to be a la carte. We require a signature. And then section F at the bottom and G is where you're going to be waiving. If you're going to be waiving, we do need a reason, and we do need to collect those waivers from everybody. The next page is the second page that needs to be returned to CBR. This is your employer paid life insurance. This is where you're going to fill in your name. You're going to fill in your beneficiaries here at the bottom. Again, if you're legally married, your spouse should be the first person, and then you can divide it after that. This is going to be your flexible spending account, your FSA for your medical or your dependent care. This is the one that you would like to that you need to fill out. Keep that in mind. Remember that whatever amount you elect for July 1 to the end of the year is going to be deducted from your paycheck. So just keep that in mind when choosing a dollar amount. This is the voluntary life insurance. So if you're going to be enrolling in the voluntary, complete this, the amount for yourself and your spouse, and then the rates are going to be, let me just get to that, maybe it's on the next page. This is going to be for the short-term disability. It is based on your age, and it gives you example on how to figure out what your benefit will be and what your per paycheck cost is going to be. But if you need help with that, we'll be happy to assist. And then this is the AFLAC interest form. It doesn't, by filling this out, you're not buying anything, you're not bound to anything. It's just telling Jose and his team that you'd like to have a one-on-one with one of the AFLAC representatives to go over the comparison, the medical, the gap plan, the short-term disability, and all the other products that AFLAC offers to see what best fits you and your family. I have just another few forms to go over. So additional information in regards to the Legal Shield and ID Shield, there is a link at the very top. We ask that you go there, enroll. We do payroll deduct the Legal Shield, ID Shield, AFLAC, pet care, anything that you signed up, we do payroll deduct. And these are all going to be post-tax deductions. Medical, dental, and vision are pre-tax deductions. So it gives you additional information on what is covered for the Legal Shield and the ID Shield, and then instructions on how to enroll, and then the premiums are at the bottom. So for individual or family, if you just want one or if you want both, it tells you how much it's going to be per month. Pet care, United Pet Care. So it gives you more information on what's covered, teeth cleaning, vaccinations, physical exam, radiology, spay and neutering, and then the premium per month for the United Pet Care. Again, there's a link here that you click on, you fill out the information there, and then CBR will get an email saying that you've enrolled and will payroll deduct. This is the full life insurance policy. This is a voluntary program. So on here, you'll see all the limitations and exclusions, things of that nature. And then you'll also see what it's going to cost you. So on page 3 of the life insurance, you'll see what the cost is. It is going to be based on your age. So for $10,000 of life insurance, a 24-year-old is 68 cents plus 20 cents for the AD&D, doubling that 10,000 to 20, 88 cents a month for $10,000 of life insurance. Is very inexpensive.
Leticia,
yeah.
I'm sorry to interrupt. I had quite a few people ask questions about this yesterday.
Okay.
And so I just want to mention that if somebody's looking, for example, for 100,000, then you will look at your age bracket and multiply this rate times 10. If you're looking for 150,000 times 50, and if you want the full 200,000 times 20, and then you add you multiply the 20 cents times 20 as well. So adding those two amounts would give you the monthly amount, and then we are going to convert that. We would take half because we do set it up by pay period. So
correct.
Just wanted to mention how that works.
Yeah, so in the same worksheet, there is a calculation worksheet. So it tells you the employee amount. So you look for your age, for example, 668, and then you add the 20 cents for the AD&D, making it 688. So that's what you're going to be paying. And then that goes in the rate, and then the amount. So if you want $200,000 divided by $10,000 times the rate is going to be what your monthly cost is. So you'll be $200,000 in this amount divided by 10,000 times your monthly rate is going to give you your total monthly cost. And then, as Noemi stated, we do semi-monthly, or how your payroll is set up. So that's what they'll see coming out of their check. The same applies for the spouse. The children is different. The children is 50.556 plus 0.04 for AD&D per 2,000, and it's the same. If you have one child or 10, it's all going to be the same premium. It's not per child, it's total children. So that's a really good savings there. But if you need assistance, we'll be happy to help with calculating those premiums out. Does anybody have any questions in regards to anything we've gone over, or I've gone over?
And remember to unmute yourself if you do have a question.
Okay, that completes my portion of the presentation, so I can turn it over to Noemi.
All right. Well, thank you, Leticia. I want to thank all of you this morning for joining. We are very excited about this partnership, and I just want to, mention, Mike, how great it has been